much, everyone, for being here. We're really thrilled to have Dr. Dora here to share her wisdom with us. Just a little overview of the program. I am part of Yale Women NYC and also the YAA Board of Governors, along with Elaine Gustafson. And we are putting on this program because it's alumni to alumni opportunity for all of us as alums of Yale University to learn from each other. And we thought this was a very fitting topic for this time in our history and the world. And we are so glad to have you here. So the layout's going to be that we'll begin with some commonly asked questions, go over some questions we had submitted beforehand, kind of get the lay of the land out there from Dr. Dora, and hopefully have time for some questions from you all at the end so we can cover topics that are really relevant to you. So with that, I'm going to hand over to my colleague Elaine, who will introduce Dr. Dora, and then we will start the program.
It's my pleasure. Welcome, everyone. I'm just going to give a short introduction. Dora-Linda Wang, MD, MA, is a graduate of Yale School of Medicine and the UCLA Neuropsychiatric Institute, where she specialized in the treatment of anxiety disorders and obsessive compulsive disorder. She has given a TEDx talk on the high cost of anxiety, and I'll put the link to that in the chat if folks want to check it out later. Dr. Wang has balanced a dual career as a practicing psychiatrist and literary author. She is currently president of the American Psychiatric Association Caucus of Asian American Psychiatrists and has been the Pfeiffer Visiting Scholar at the Stanford School of Medicine. She's the author of a memoir about the profession of medicine transforming into a profit-driven industry. It's called The Kitchen Shrink, a psychiatrist's reflections on healing in a changing world. It's published by Riverhead Penguin Random House in 2010. She's been the recipient of a Lannan Foundation Writers Residency and a New Mexico, Arizona Book Award. She serves on the executive committee for Yale Alumni in Medicine. She will be moving to New York City in the fall and looks forward to connecting with NYC Yaleys. I give you Dr. Wang.
Elaine, thank you so much for that wonderful introduction. And Sterling, thank you so much for inviting me. It was so wonderful to meet you at the Yale NYC event on Gatherly. So tonight's topic, and Sterling is so humble. Thank you, Sterling, for picking the topic. So I'd like to talk about anxiety and peak performance, and they are connected. Because in this day and age, it isn't so much the quantity of work that you want to get done or even the timeliness of it, but how well you get it done, as well as just the quality of the ideas, the quality of the work. And so in order to have peak performance, I think you need to be at your best. In relaxed states, we tend to produce better, we tend to have better ideas, we tend to, so if you think about your brain as an orange with the rind on the outside, that is the cortex, that is the thinking and doing part. But most of your brain, the inside or the pulp of the orange, is the feeling part. And so the majority of our brain actually is the feeling, emotional part. And to have that connected with our thinking, doing part is I think the goal in being at our best and for peak performance. So a little bit about anxiety. Anxiety is a basic emotion that has ensured the survival of the species, actually. So every living animal has a fight or flight response. And if you imagine human beings, at the dawn of mankind in the savannah, and like a jaguar running at you, all of a sudden you have this fight or flight response. Your muscles tense, your heart starts racing, you breathe more quickly, and you're purged to flee. And in this day and age, we are no longer confronted with those kinds of life-threatening dangers on a day-to-day basis. But we still have anxiety. We still have a flight or flight response. And oftentimes it works for us rather than it works for us because it is protective. Anxiety altogether is protective. It's a signal to us that something is wrong, that there's kind of danger to yourself here. But also anxiety can get out of control and work against us rather than for us. And so that's why it's good to get anxiety under control. There are anxiety disorders such as obsessive compulsive disorder, which is about 2% of the population. There's panic disorder. About more than half of us will have a panic attack sometime in our lives. And that's the fight or flight response coming to the surface, even when there is no real threat. There's post-traumatic stress disorder, there's social phobia, and there's specific phobia. So those are the anxiety disorders. I think what I'd like to focus on tonight is just run-of-the-mill anxiety. And I'm happy to talk about the disorders also. I thought it would be good to start with an exercise just to arm you with a couple of techniques, and this will take about 3 minutes. So like everybody right now, to just rate your own anxiety on a scale of 0 to 10. And on a count of 3, I'd like you to call out your anxiety level on a scale of 0 to 10. 1, 2, 3.
10.
3. 7.
8.
5.
2.
7.
2.
Hi, Christine.
7.
5.
4.
Okay, remember your anxiety level. Okay, and for those of you who said 10, oh my goodness, I hope it's not me making you nervous. Okay, so now I'd like you all to think of a place in your life. Think of a place where you always feel happy and relaxed. And on the count of 3, I'd like you to call out that place. 1, 2, 3.
The Adirondack.
Nature.
Rhode Island. Shore.
Beach Island, New Jersey.
Beach.
Beach.
My
Okay.
bedroom.
Outdoors.
Okay.
Yeah, the park.
Park. Thank you.
Mountain.
Okay, I'd like you to now close your eyes and step through the curtains on the stage, or actually let's step through our Zoom screen into this place where you always feel happy and relaxed. Now in your mind, think about what you see when you look ahead of you. Now in your place, if you look to the left, what do you see? Look to the right, what do you see? Now look above you. What do you see? And look below you, toward your feet. What do you see? Are there any sounds in your place right now? Any smells? And what do you feel on your skin? Okay, I'd like you to first open your eyes and step out of your place back through the Zoom screen. And you're back in your home or your office. Okay, at this time, I'd like you to once again tell me what your anxiety level is on a scale of 0 to 10. On a count of 3. 1, 2, 3.
5.
4, 3,
6.
4,
So it seems to me that I heard far fewer 10s the second time around compared to the first time around. And it seems like people's anxiety levels decreased when you took this little mini vacation that altogether took 2.5 minutes. And so that's how long we were gone for 2.5 minutes. And this is, I like to do this exercise because it shows you that your thoughts and your emotions are connected. And so what you think affects your anxiety level and your emotions all together. Also, what we did during this exercise is we learned to rate our anxiety. And simply by rating your anxiety, you have a little bit of control over it. You can, by rating it, you can try to do things to tune it up or down. And also, simply by rating it, you're using the cortex of your brain, that is the thinking, doing part of your brain, and you're shunting blood away from the feeling, emotional part of your brain into the thinking part of your brain. And so you're thinking about it. What is my anxiety level? So by analyzing it, you actually probably decrease the anxiety, or you're shunting blood away from the anxiety centers of the brain. Any thoughts, or maybe this is a good time to open up to the questions and answers that Sterling was thinking about?
Yes, thank you, Dr. Dora. That was incredibly helpful and relaxing in every way. So I think that we'll all be using that in the future for sure.
Glad about that.
And that was kind of leads into something that is probably good to cover, tactics like that. That's one really great tactic that you went over. What are some other, I know that you specialize in a lot of cognitive behavioral therapy and other techniques. And what are some other techniques that people can use to, put in their toolkit to use?
Okay, so anybody who's gone to like relaxation classes, or you've probably heard of progressive muscle relaxation, where you tense some part of your body and you let it go. In my experience, highly intellectual people get bored. It doesn't always go over that well. This a kind of more cognitive exercise like what we did seems to work better. However, as somebody who likes shortcuts and to do things efficiently as a mom, muscle relaxation is actually a very good idea. And headaches, there are 2 types of headaches. There are migraines, and then there are tension headaches. And tension headaches are basically due to tight muscles in your neck. And so if you can relax your muscles, you will actually feel better. And rather than all these progressive muscle relaxation exercises, it's possible to just relax them. It takes practice, but you can just say, all right, now I'm going to relax all the muscles in my face. So try it. On the count of 3, everybody try to relax all the muscles in your face. Just let them go. 1, 2, 3. Okay, and now on a count of 3, try to relax all the muscles in your neck. 1, 2, 3. Does anybody have any feedback about this, or did it work for anybody? Oh, Rob. Hi, Rob.
Hi.
Rob says neck is harder than face. Hi, Rob.
And I have a lot of tension in my neck, I guess. But
Yeah,
it's
sometimes
a start.
you need a neck rub, but it takes some practice, but you can actually tell your muscles to relax, and they will, because you're telling them to tense up.
So Dr. Dora, and I know in your TEDx talk, you also talked a little bit about exposure therapy. And is that things people can practice at home, or is that better doing with a professional? How would you advise people to kind of think about that?
So the main key with, so exposure therapy is the main way to overcome a phobia or almost any kind of anxiety, social anxiety, even post-traumatic stress disorder, where you might be afraid of reminders of a past trauma. So just, so the basic concept is just, if something makes you anxious, you tend to try to avoid it. It seems natural to avoid it. However, you should really do the opposite and confront it. So all the time, in the past, I used to get calls from medical school and here in New Mexico. We have a med student with a needle phobia. And the med student has no time to see a therapist. So what are we going to do? So I just get on the phone and I just say, okay, I give them an assignment. And actually, I did this with a student, one of my students in the classroom once, and she had a needle phobia. So that's why she became a psychiatrist. But I asked her to bring in a needle and just hold it in her hand. And her anxiety rose and rose and rose, and then it extinguished. And then I asked her to put the needle down and pick it up again. And this time her anxiety rose again, but not as high. And then it extinguished. And then we did this again, and her anxiety level rose just a little bit. So that's called extinguishing anxiety. And so is it better to do it with a therapist or on your own? Preferably if you have an experienced therapist that's who can give you assignments. That's great. It's often difficult finding that therapist though. So the general concept is just to face it, and until it doesn't make you anxious anymore, until you may even be bored by it. After a trauma, I was actually in Manhattan during 9/11, and I remember Tower 2 pancaking. I had no idea what I was looking at, because you have no idea. I mean, who's ever seen anything like that before? But there are studies that showed like the whole city had trauma afterwards, and the whole, so many people were numbed out and dissociated. And that's one example of trying to avoid reminders of trauma. It's just numbing, this numb feeling. But I like to tell people who've been through a trauma or any kind of trauma, like my daughter was in a car accident last week. And if there are any new anxieties, any new things that you avoid after a traumatic incident, then you want to not avoid it. You want to really confront it. Otherwise the anxieties will grow and grow and grow until you're a Vietnam War veteran who can't leave the house. Yeah.
I think that's very helpful and applicable, I'm sure, to a lot of people. And we're getting some questions here in addition to the ones we have. And one that I think is going to be on a lot of people's minds and kind of dovetails with what you were just talking about is someone's asking about tips for dealing with kind of unspecific anxiety about the changes we're about to undergo as the world reopens. And I'm sure that a lot of people are having that, returning to the office, greater social interaction. Can you speak to that for the group, please?
Yes. So one helpful thing to keep in mind is just that transitions are anxiety provoking because it's new. And to just see it as a transition and not as a permanent state. Like sometimes when we're anxious about something happening, you know, it's like, okay, what if this happens? What if that happens? What if I can't do it? Blah, blah, blah. But if you just think about it as temporary, this is just transitional anxiety. And if you just label it as a transition, then you think about the other side, and hopefully you'll be less anxious just by labeling it as a transition. And it's natural to feel anxious in a transition. The other thing you can do is just realize what you can control and what you can't control. Like, for example, as things open up, what you can control is show up. Like, let's say your office opens up and you're anxious about it. You cannot control what other people do. That's not in your control, but you can set your own goals, such as I will show up, I will do this, I will stay for the whole day. And then if you accomplish that what is in your control, then you can consider yourself a success. For example, all the time I get patients coming to me, oh, I need to get this job, or I need to, or recently with my own daughter, I need to get into this college. So, you know, for example, with the job, whether this employer hires you or not is not in your control. It could be that they already have somebody in mind and that's why they advertised. It could be that all of a sudden the position gets eliminated or the money runs out, and that's just not in your control. But what you can do is send in your CV, you know, go to the interview. What you can do when you're looking for a job is to say, okay, I'm going to make a call every day for the week, or I'm going to look in these certain places. I'm going to make the calls. I'm going to send out the CVs. And then if you've done your part, just think of yourself as a success. You know, I did it. And over the long run, actually, just acquiring those habits of setting your goals and accomplishing them, those are good habits, and these are the habits for success. So just so in summary, just think about what it is that what your own goals are. Are you going to, and what can realistically be accomplished on your end? And then if you accomplish that, then call yourself a success. If your goal is, I'm going to walk into the office and everybody's going to be happy to see me, that's actually not a realistic goal, because people might be grumpy. Maybe people are just out of practice with seeing people. But if you could actually revise the goal as, I'm going to walk into the office and I'm going to enjoy myself, or I'm going to walk in the office and I'm going to find something to be happy about with every person I see, or just I'm just going to show up and get through the day and see what happens. So just reframing things to realizing what's in your control and what's not is a way of decreasing your anxiety. You can be very anxious about things you can't control, such as what other people do. And that's not very useful anxiety. And it's better to channel that thinking into what is in your control.
I love that. And I think it does help give people a feeling of agency in their own outcomes and their process that they can manage. So I think that is a great way to kind of think about it, help people think about it. Another question we're getting is, it's kind of a two-part question. So the specific question is basically, if someone's interested in pursuing therapy through a culturally or ethnically specific lens, how does one get started without feeling like they are dating a bunch of folks? And I want to tag on to that question that, you know, so often you hear in the media, you know, oh, if you're struggling, get help, get help, get help. But as you know, from especially, you know, the book you wrote, it's not that easy to find help, and not everybody can access help. And, you know, some people don't have insurance and can't, you know, afford how much it costs to get therapy and things like that. So if you could speak to both that question and also the broader, you know, how does someone go about getting help from all different starting points, and, you know, what are the resources available for people?
So first of all, thank you for that summary of the situation, Sterling. It's a very accurate summary. And I'd have to say that it's especially difficult to find culturally congruent or linguistically congruent services, but it is also challenging for everybody. And then oftentimes it's the fit is what you're looking for with the therapist, and there really is no other way except to try different therapists. Getting a recommendation is also a really great idea, because it's really difficult for you to tell if this person knows what they're doing or not. So getting a recommendation is a good idea. Like for example, like for obsessive compulsive disorder, for example, traditional talk therapy doesn't really help. Examining your anxieties doesn't really help. You just need to face them. And so if you go to like an insight-oriented therapist who doesn't do therapy for OCD, then it may make it worse, actually. So you want to ask the therapist about their experience. I'd say a lot of times, a lot of things do get better just by talking about them. Anxieties, fears, because just by talking about things, you face it, and then you also make meaning of things. And you know, depending on who you're talking to, you may get good feedback. So just somebody to talk to is somebody who you feel like listens well. That's a place to start. And then there are like some medical specifics that it's good to get a recommendation. So these days, the best place to start would be your primary care doctor, or if there's somebody you know. And Christine Walsh, Amy Liebeskin, we had talked about the idea of the alumni of Yale Alumni in Medicine having some kind of referral process. And I think, of course, your Yale colleagues are a resource. And then these days there are EAP programs where you can call and just talk to somebody on the phone. There are telepsychiatry services. What else? There are apps these days, and they actually are helpful, but I think of apps as kind of like the gym. You know it's helpful, but do you really want to go? Something that is beneficial for everybody is just getting exercise. I mean, seriously, just getting that 30 minutes of 20 minutes or so of exercise every day, or enough so that you sweat. It means some chemical change has happened. And exercise actually gets your adrenaline, your catecholamines going, and antidepressants, that's what they work on. So it seems kind of reverse logic to say, oh, it's like a natural antidepressant, but that's what you get from exercise is often what antidepressants are trying to achieve. So just by getting exercise, you will lower your anxiety, depression, your risk for osteoporosis, breast cancer, and for heart disease. So just just the exercise is a place to start.
That's great, and great, and exercise or getting outside is so helpful
Yeah.
for so many people, and
Getting
that
outside.
hopefully, especially with COVID, and vaccines and everything, people feel more comfortable venturing further afield and getting the benefits that can be found through that. Is there specifically, I know cost is such a barrier sometimes, are there resources that are more affordable, or is that just going to be one of those problems that needs to be confronted with with the medical system?
Well, I was, that is a huge problem. I think the official statistic is that half of US counties have not one single mental health practitioner. And yet the Affordable Care Act mandates that mental health be covered on par with physical health. Yet it's just impossible in most counties. However, but today with telemedicine, maybe things will change. I understand that CVS is going to be making mental health available at its drugstores, and it's going to be providing counseling. So I think there is that kind of direction that people are looking in that direction. I think that yes, that it's helpful to find a professional. And if you can find, these days the answer actually is to ask your insurance company. They control the payments, and so that's the place to start actually. If you have insurance, is to ask your insurance company, and it should be covered.
Great, thank you. And it is helpful. I know insurance companies have apps, and they're much more accessible than they used to be for finding things. I happened to download the Aetna app yesterday, and it was working very well. So,
Oh,
didn't even know that existed, but good to know. Question: two people have asked a question along this line. One is an actor asking about, stage fright exercises. And then another is saying, when you feel anxiety start to come on in a specific situation, such as a meeting you're about to enter or that you're in, what are some real-time immediate things you can do at that moment?
okay. So, I was looking at those very same posts, and so one thing to think about is that we all have social anxiety. It's just a matter of degree. But when thinking about somebody judging you, I think it's just one shift in your thinking can be helpful, which is instead of, oh, like when you feel like somebody's judging you, or you're afraid somebody's going to judge you, instead of thinking, oh, how can I please them? Or, oh, I'm not good enough, and all these jumping to conclusions, to just make that shift and think, well, it's too bad people are judgmental, or too bad that person is judgmental, or I wish people wouldn't be so judgmental, or even it's wrong to be judgmental, or I don't want to cater to judgmental people, and I don't want to cater to critical people. And to think about the people who are more receptive. Like, for example, I had a patient once who was a medical school dean, and she was just ridden with anxiety, which is probably why she was so successful. But her habit, because she had this really critical father, her habit was that she could walk into a room and everybody could be smiling and happy to see her. But if there was one critical person, that's the person she would focus on. And so, of course, I started with my psychodynamic interpretation. Of course, it's because your relationship with your father is the relationship you know how to do. But the thing is that she would just focus on that critical person and ignore all the other more reasonable people. And so I think that's the key. So, like, for example, whoever the actor is in question, and you're getting on stage and people are there to see you, and they want to see you. That's why they're there. And maybe there are a few curmudgeon-y people in the audience and who are going to be critical of anybody. You know, my advice to you is you know, you just can't think about them. You know, you can't change your behavior for the few judgmental people out there, but you have to think about the other people who are more reasonable. A quick relaxation habit that I do myself, like walking from one patient's room to another, you know, this whole thing of relaxing your muscles, you actually can do that. You can just say, all right, I'm going to let the tension go in my face and my shoulders, my neck. I'm just going to let it go. Another thing you can do is that breathing, like meditation focuses on breathing. All cultures seem to have some kind of, you know, meditation practice. But breathing actually, it changes the chemistry of your body. And that's the reason we breathe. So, you know, people seek an Ativan or a Xanax, whatever. And I just say breathing is actually faster in terms of changing the chemistry of your body. And the right way to breathe is it's kind of the way opera singers breathe, which is you breathe with your belly and you try to keep your chest still. So I guess we could do this right now. If you put one hand on your chest and one hand on your belly and breathe, keeping your chest still and just using your belly. So belly up, 2, 3, and belly down, 2, 3, belly up, 2, 3, and belly down, 2, 3, breathe in, 2, 3, and breathe out, 2, 3. So I've often been the psychiatrist in medical settings, and somebody's having a panic attack and they'll say, go get the psychiatrist. And so I've often stopped panic attacks by this technique. And all the research shows that this technique actually is the main thing that's needed to stop panic attacks. That relaxation techniques are, like, this is the most important one because it actually changes the chemistry of your body. A lot of times I can tell when somebody's an anxious person because they're breathing with their neck muscles and their chest muscles. And those are all so many little muscles, and it's so much work that they're doing. And then they're releasing so much lactic acid in your system. And so if you just breathe through your diaphragm, that's a very efficient way to move air, and you get less worn out. There's less lactic acid in your system. Yeah. So yeah, just breathing and don't focus on the judgmental people.
Yeah, ignore the
help them
judgmental people and remember to breathe. Very, very good advice. So we're running up against time because we're going to end 15 till the hour, everyone. But I want to try to squeeze 2 more questions in if we can, so we can do kind of a lightning round. So one we really wanted to make sure we covered was, you know, a lot of people on here are parents and have, you know, especially preteen teenagers who, you know, it's a complicated time in life already. And then this year has just been so extraordinary. So what advice can you give parents who are helping loved ones, particularly children, kind of cope with these things? And then the next one we'll go over, I wanted to just go over, per one of the questions, was comorbidities, like medical comorbidities. Somebody was asking about thyroid disorder that they thought was feeding their anxiety. So if you could just address those 2 things, and then we'll let you run.
Oh, it is a big birthday for me. This is so wonderful spending it with you. Helping children. So Winnicott was a psychoanalyst who coined the term good enough parent. And, you know, you don't have to be perfect. You know, as a matter of fact, some of the tiger moms, they're, you know, that's a big controversy, but what we want to strive for is just to be good enough. And you're not really replaceable. You're the kid's parent. They don't have a lot of options. So I'd say just chill out and just try to be good enough. And
Oh, and Dr. Dora, sorry to redirect, but how they could help their children, not feeling parental anxiety, but how they could help their preteens.
oh, their children's anxiety.
Their teenagers or preteens, exactly, yes.
Yeah. So they often, they learn from you and they pick up on your anxiety. And so the more relaxed you are, they'll learn from that. And then, yeah, it's just a very stressful society these days. And I just try to let my daughter know that, that anything she does is fine. I help her try to find herself, do things that are true to herself, because yeah, there's so many pressures out there. You just can't conform to everything. And yeah, just conforming, trying to be something that you're not is very anxiety provoking. And yes, there are many medical causes of anxiety, such as hyperthyroidism, such as hyperadrenalism. And so sometimes it's a good idea to go to your primary care doctor and to get labs and get that checked out. Yeah.
Good. Well, we are wrapping up or butting up against time, but I want to just thank you, Dr. Dora. This was invaluable information and help. And thank you everyone for joining and participating.
And thank you so much. It's been such an honor and a pleasure to be here. And I hope you'll have me back, like maybe when things open up in person, and maybe we could all get together in person.
Yes, more breathing exercises for everyone.
Yeah.
Enjoy your birthday. Happy birthday, Dr. Dora.
Yes.
Oh, thank you so much.
Thank you for being with us. It was wonderful.
Thank you,
Bye.
everyone.
Thank you very much. For those still on, there will be an event next Thursday and the following Thursday at 8 p.m. So we hope you'll come and join us again then. Take care.